This is a somewhat unconventional talk in that it's not an empirical paper, it's not a narrow talk. I'm in the final stages of completing a book on this topic of administrative burden with my co-author Pamela Hurd. So you'll see a lot of examples that are pulled from different areas that hopefully become a coherent story by the end. And the book is mostly about making the case for a concept and setting out a research agenda for the future. Hopefully other people become interested in this area, and if they are interested in it, I'm happy to talk with anyone who wants to do empirical research on administrative burdens. And that we're still at the point where we're almost ready to submit the book, but we can certainly take on comments and suggestions if you have those about the topic. So let me start with making some observations that motivate what I'm going to talk about today. One is that I identify as someone who works primarily in the field of public administration, and if you look at the type of interactions that we study, they could be interactions between people and the elected officials and bureaucrats, bureaucrats and the public, bureaucrats and third parties. Governance is mostly built up of a series of interactions. We spend most of our time focusing on public employees, but we don't spend much time focusing on how public employees engage with citizens. And so we use the term here, citizen-state interactions, to identify a venue that we think has been relatively understudied within the field of public administration. And we think part of the reason we don't pay a lot of attention to that is we don't have many theoretical frameworks to help us understand or develop insights into those interactions. So I'd make the case that two questions, or three questions, that should be central to our field but are not, is how does the state impose burdens upon its citizens? And why do those burdens occur? What are the consequences of those burdens? I think we need some sort of theoretical framework that can help us to ask those questions and answer those questions before we can really move forward with them. And I'll start with some simple motivating examples. So for those of you who work in the area of social policy, you probably already know this, but we have two basic types of policies: universal policies that everyone's entitled to, and means-tested policies. Means-tested policies means that some people are eligible, some people are not. We have to put in place some requirements to verify your eligibility. What we find is that really large proportions of people who are eligible do not receive means-tested programs, whereas almost everyone receives universal programs. Almost everyone who's eligible for Social Security gets it, depending on the numbers. So if you look at supplemental social insurance, between about 40 to 60% of eligible people get it, about 30 to 60% of unemployment insurance, about 75% of the earned income tax credit. So somewhere between 1/3 roughly to 2/3 or maybe 3/4 receive means-tested programs. And that's probably partly because of the requirements that they have to go through to demonstrate eligibility. A second example that is perhaps closer to home. So as Bill mentioned, I graduated from the University of Limerick. I'm from Ireland. I moved to the United States. As an immigrant, I went through the process of getting citizenship. And it's a very onerous process. I remember at one point seeing a stack of what seemed like very confusing forms to me and thinking to myself, I have a PhD in public administration, and this is hard for me. Right, so how hard is it for someone who doesn't have that education, who doesn't have financial resources to hire an immigration lawyer? How difficult is that process? So among those people who are permanent residents who've stayed in the United States long enough to become citizens, about half of them don't elect to take up that benefit. And that could be for a variety of reasons. Maybe they're French and they really identify with their Frenchness. They don't want to give that up in any fashion by becoming a US citizen. But at least partly it's because we think of some of the barriers that they have to encounter. So they have to pay to become citizens, they have to undergo tests in English, and we know that the people who are eligible for citizenship but the least likely to take it up tend to be immigrants who have lower education and for whom English is not their first language and who have lower income. And so there's some selection that's happening into the status of citizenship there. As I'll talk about in a little bit, different forms of voting procedures generate different levels of turnout. And I'll get into that study in a bit because this is something I co-authored with a couple of political scientists where we just looked at how election laws made the process of burden more or less prominent when someone went to vote and how then that mattered for turnout. These are really simple examples about whether we get things in our interactions with government, our status as citizens, whether we participate in governance, that I think are at least partly conditioned on the types of burdens we encounter that the state puts in front of us. So we're using this term administrative burden. Are there other places that talk about this? It's not an entirely novel concept. Anyone who's heard the term red tape in their life is at least somewhat familiar with this idea. We certainly see some attention to this at the intersection of public administration and social policy. In particular, the study of street-level bureaucracy pays attention to how street-level bureaucrats use their discretion to place onerous barriers on some groups of citizens that they may feel animus towards. We see it somewhat in economics. So if you look at some economic studies, so for example, the work of Janet Curry, where she looks at take-up of programs, they will sometimes use a concept that's very similar to what I'm talking about here. And if you look at behavioral economics, and they're at least attentive to the idea you have to nudge people to get past some sort of barriers to get access to services. But the argument I'd make is that despite the fact that you see this idea pop up in different places, it doesn't really cohere into a unit of analysis for research where all of those different scholars are talking to one another, using the same language, and where knowledge is actually accumulating. I'd also make the point that some aspects of burdens are attended to in some of these domains, and some aspects are completely left out. And so a large part of today's talk will be to talk about the political dimensions of administrative burdens, which I think are almost unattended to within the field of economics. So let me start by defining now, finally, what I mean by administrative burden. Part of my different interests are in election administration, as Bill mentioned. And so a few years ago, I was writing a paper with some co-authors on election administration about how local elected officials found new policies to be more or less onerous. And I was already thinking about this topic of administrative burden, so I snuck in a definition of administrative burden at the end saying it's individuals' experience of policy implementation as onerous. Also, my co-author was Barry Burden, so it's generally a good rule if you're trying to define a concept to find a co-author who will memorably demonstrate that. In some later papers in JPART, we made the argument that it occurs in any context where the state regulates private behavior or structures access to public services. But clearly the concept here is a little thin, so we need to elaborate more. In the JPART paper that I mentioned, we basically said we can go a lot further if we at least define the types of costs that you encounter as a citizen. So let's create some boxes of costs that cumulatively add up to being burdens and probably interact with each other. So the first of three different costs is learning costs. So if we have to find out about, say, the Earned Income Tax Credit or some sort of social program, we're not born with this knowledge. It's not innate to us. We have to spend some time and effort finding out about it. You have to find out if a program exists, if you're eligible for it, how much it'll actually benefit you, how do you actually apply. And this seems very straightforward, but a lot of people are not aware of the fact that they're eligible for many social programs, for example. So something like the Earned Income Tax Credit, which is one of our best known, biggest social income support, about 43% of those who are eligible are unaware that the program exists. About a third of those who are eligible believed incorrectly that they're ineligible, and they consistently underestimate the benefits that they would get from the program. We see similar numbers of estimates for people who are eligible for SNAP or food stamps or job training programs. And you might also assume that some of the barriers that we found that explain take-up of social programs might be a function of learning costs. So if you live further away from an administrative center, you're less likely to take up on a program. If you have lower levels of education, if you have speak the non-native language, if you're not familiar with a local language, you tend to be less likely to take up a program. Partly because learning then is a more expensive thing for you to engage in. On the other hand, there are things that we might assume reduce learning. So if you're a union member and get laid off, you're more likely to get unemployment benefits because the union will help you through that process. If you're a veteran seeking disability in a state where there's a very active veterans group, you're more likely to get disability because they will help you negotiate that process. So third parties can help to reduce the learning costs that you encounter. Simply telling people that the program exists or what they might get from it increases take-up. Again, looking at the Earned Income Tax Credit, the IRS sends reminders to people that they assume are eligible but who haven't taken up the program, and that seems to increase take-up. There was an experiment that showed that sending people additional reminders that told them how much they might benefit further increased take-up. So it seems reasonable in some cases if you just tell people that something exists and you could benefit from it, that reduces their learning costs and makes them more likely to take up the program. The next part of the concept, I should have said at the start, jump in with questions or disagreements along the way. Okay.
Yeah, so I know you're going to further elaborate on it, but what triggered in my mind is, since you use the term burden, so apparently it's a negative connotation, right? But in the literature, of course, the other parallel concept could be co-production, right? Usually, when people use the term co-production, they more or less have a positive connotation, meaning you really engage the citizens when they are utilizing the service. So how does your concept relate to the concept of co-production?
Well, that's a good question. I think to the extent that citizens find engagements with the state to be onerous and unrewarding, it becomes more likely to fall into that category of burden. To the extent that they find it to be beneficial and engaging, it's more likely to fall into that category of co-production. And I think when we get to the end of the talk, if there's one practical point that comes from this, is that you should design interactions to have some element of positive engagement and respectful interaction that makes people feel like it's more like a co-production rather than a waste of their time. So if you have to answer the same question 14 times, I'd submit that feels less like co-production and more like a waste of your time, whereas if you feel like you have had a role in controlling the outcome, and so I think Joe Soss has done nice work on parents who've engaged in Head Start, then you feel a little bit more empowered and that you've had a role to play in the process.
So I'm going to figure out, why do you call it burden and not just participation costs? Like, there's going to be just a general cost to participate in anything. When you say burden, you think above and beyond, sort of what is minimally required to get something done, or is it just the full cost?
So burden is the catch-all for the different types of costs. So you could use the term costs instead. We're just using a different word for that. I don't know if it's better or worse. But the idea is that you have 3 different buckets of costs that collectively accumulate to being burdens.
But, so I hear what you're saying.
Yeah.
But I do think that burden, the word burden implies unnecessary, or undesirable.
Right.
And like the process of of the program figuring out that someone's eligible, that's not avoidable.
Yep.
Right, I mean, unless every program is fully available.
I'm going to save myself some time here by showing you the slide that I should have put at the start of the talk.
So you're saying, if I'm interpreting you correctly, that burdens has a negative connotation in all cases. This is very similar to a point that is bedeviling the public administration literature on red tape, where the definition of red tape that's commonly used is that red tape always imposes a cost and has no benefit. And so partly we're using this language to distinguish ourselves from that literature. I believe things can be burdensome and beneficial at the same time. Right? There are some cases when burdens serve a useful societal purpose. Right? I'd submit costs also have some sort of negative connotation as well, but at least in our theoretical framing, we try to say there are some cases where you want to have burdens in place because the benefits are sufficient, and there are some cases where the benefits are not sufficient. And that distinguishes a definition ourselves from a definition that says burdens are always a bad thing and we should always remove them.
That needs to be your second slide.
Okay, that is excellent feedback. But
Because, I mean, in income, we call them transactions costs, right? And that's a more generic term that doesn't have a normative overlay.
Maybe, I think costs do have a normative overlay.
But there's a cost to everything, right?
Oh.
So to the extent that cost always exists, I don't see
Costs
how
are always
that
burdens.
inherently is normative. I mean, there's a cost to do everything. Right? No one enters any of these things expecting there'll be zero cost.
Well, that's-
We hope there's zero cost.
But
So
you
that's-
could also say burden in the same way.
Yeah.
So that's the
That-
empirical
that's what
question.
I'm
And
saying.
I think actually, to both of your defenses, I mean, I think when he made the explanation of what burden was, he was just exchanging the word cost for burden.
That's right.
But at the same time, I didn't feel that it was, I think this is a semantic argument more than anything else.
So I don't think that's true. But this is an empirical question, right? We could put a poll out and poll 100 people, and my guess is more than 50% would think that burden was a negative thing.
Let me
And more people would think burden was negative than would think cost is negative.
Well,
that is an empirical question, but let me hypothesize that the people who view cost as a neutral value term would be more likely to be econ majors. Because you've been trained to think about cost as a neutral expression of this, whereas I think if you're coming from political science or public administration, the term costs has similarly vaguely negative frames as burden does in our case.
We just found a research project.
Okay, all right. Yes.
Ed can do that.
One question I have, on the percentages you were showing for people who aren't aware of earned income tax credit, they're not aware that they're eligible, is there some portion of that pretty high percentage of people that are receiving that benefit, even though they don't know they're receiving it?
Yep. So the best example here would be the earned income tax credit, because on the one hand, I told you that 75% of people who are eligible get it, but at the same time, more than 43% of people are unaware that the program exists.
So to me, thinking about the people who don't know about it and are not getting it, but are eligible, is an interesting distinction to think about where getting them more information and participating would be beneficial. and it dovetails with the literature on kind of putting in default settings for people, like on their retirement savings and all these other things, so that people default into categories that would presumably.
Oh, yeah, I agree absolutely.
But it
So,
sounds like there's some big portion of people who aren't getting it, and who don't know about it and are not getting it,
Yes.
who would be eligible.
yes.
So the
Very much
example that I think about is the enterprise zone program. So state enterprise zone programs, you had to opt in to get the credits. And what many jurisdictions were finding was that none of the businesses were opting in. So they hired someone to go around and actually tell every eligible business, you're eligible. Here's the, and like hand them the form to get that kind of participation. So the opt-in, opt-out is a huge factor in terms of how important this is.
So I think it's more, the EITC is an unusual example that you have people who are really unaware of the program and are benefiting from it. And partly that occurs because there's a third party that's managing their learning costs, which is H&R Block, or the equivalent to that, who, when they come in with their income records, they're the ones making sure that they get the EITC payment because it's in their business model to do that. And so they're playing this really important role that probably doesn't exist in many other social welfare programs. Right? Nonprofits might play it to some extent, but they aren't quite as capable or as active as H&R Block is when it comes to getting people's EITC money back.
What I took away was that you're defining burden based on people's perception, their perception that their interaction was onerous. And that, I think, is different from a cost, because some costs we would feel are onerous and some costs we won't feel are onerous, and our perception of that will differ from person to person. And it seems to me that there are political interests that are served by having some programs, some benefit programs or access to voting or citizenship be perceived as onerous by certain groups. I don't know that I would say that they serve the state or the public that burden exists, but I would think that they serve some political interest.
Yeah, there's certainly an element of subjectivity to this. That doesn't mean that you couldn't measure this in some way that has some general dimension to it. Right? So we could generally agree that a form that has 20 questions versus one that has 5 questions is more burdensome. But it might be more burdensome for me because I really don't like filling out forms, or I have none of the information at hand and I'm disorganized, I have to go get it, or I have a relatively low level of education and some of the questions are cognitively demanding. Right? So there can be both some objective indicators of differences in burdens, but also the expectation that burdens play out differently for different individuals, but also different groups of people. So this gets me to the mention of psychological costs. And so we talk about these in 3 different dimensions. One is just the general stigma of participating in some sort of process or program that has negative popular connotations, being seen as part of an undeserving group. One is a sense of loss of personal power or autonomy in an interaction with the state. If you have a traffic stop and the police officer is very aggressive towards you and you feel like you have no real redress in that situation. It may also be the stresses of just dealing with administrative processes. If you're trying to get something like a green card or food stamps, and if you don't get that benefit that has meaningful implications for your families, that could induce some level of stress. It is very much the case that there is less strong evidence on the psychological costs of burdens than in the other areas. Mostly here we're relying on surveys of eligible people, non-applicants, so the people you were talking about who technically should be applying for programs but don't. They sometimes articulate a desire not to be seen as dependent upon the state or not to engage in disempowering processes. if they feel like they've had negative experiences with other public interactions, they tend to be less likely to want to pursue future public interactions. Studies of individual application processes are at least suggestive of the idea that these can be damaging to self-identity, intrusive. So for example, there's a really nice study of how people engage in waiting rooms, in public welfare offices, the types of questions they're asked, how much time they're expected to wait, and how they feel about those experiences. Right? So not surprisingly, you might think that might have some negative effects. If you were asked questions about your sexual behavior, for example, and you felt like you had to present a certain identity to the person asking that question in order to be successful. Other examples that are relevant if the federal government starts allowing states to attach more and more burdens to things like food stamps or Medicaid would be whether you fingerprint applicants, which is a process we normally reserve for people who are under suspicion of some sort of law breaking, or start applying drug testing. The final category, before I get some examples here and a research agenda, is compliance costs. And this is perhaps the most straightforward aspect of this. This is more like the traditional red tape we're familiar with in public administration. So how burdensome is it for you to fill out rules and requirements and the discretionary demands that are placed upon you by an administrative actor? So filling out forms, providing your documentation of status, how frequently do you have to recertify to stay in a program? Do you have to actually spend money on transportation or on legal help to complete the process? Again, this is, I mentioned this at the start, so this is a paper with Professor Burden again and some co-authors where we looked at different election laws in different states. Partly we were looking at early voting, but we were also looking at whether you have to register to vote in advance of voting or whether you can register on the same day. And we found, consistent with other studies, including a new study that just came out in APSR, that asking people to register to vote has a significant and fairly sizable effect on turnout. So if you have to register to vote 28 days before the election and then you go to vote, that reduces turnout by about 3 to 7%, depending on the estimates that you believe. Simply asking you to do something, taking one extra step that's not terribly complicated, that's not incredibly onerous, is enough to meaningfully reduce turnout. Again, looking at surveys of eligible non-applicants, people perceive paperwork and documentation demands to be discouraging to them. Some natural experiments where states have done things like move to face-to-face interviews instead of phone interviews, require employment verification. Those tend to reduce take-up of social programs. When you, on the other hand, reduce the frequency, you have to renew your status. If you replace multiple forms for different programs with a single form that collects the same information, if you use electronic applications, generally the evidence there suggests that by reducing those burdens, you tend to increase take-up. Some field experiments that have been very interesting, looking at simply providing help to people, helping you to complete a form seems to have a meaningful effect on whether you take up a program or not. And so this is from a study of people who were completing tax applications, and they were given help completing the FAFSA process. So how many students have had to go through the FAFSA process? Oh, okay. So I've never done it because I didn't go to school here as an undergrad, but apparently it's incredibly onerous, and it seems pointlessly bureaucratic. So in this experiment, people who were given help to complete the form were much more likely to submit the aid application and then 3 years later actually be in college, right? So simply giving them help to complete a form had a meaningful impact on whether they went to college. And in this case, one of the comparison groups was students who just got information, who were told, you're eligible for this, here's a FAFSA form, go fill it out. So in this case, giving help was more meaningful than just giving them information. Okay, so this is hopefully the fun part where I speculate on what a research agenda looks like here and offer some answers. So one thing I would argue that other fields that have taken on this concept have not really attended to is the nature by which burdens are constructed, the nature by which they're a deliberative form of policymaking. So Jacob Hacker, the political scientist, has made an argument that much of the big changes in the welfare state in the United States have occurred through hidden politics. So choices not made, or choices made within the executive branch out of the purview of the public, rather than large-scale traditional legislative changes. And I claim that burdens are a part of the process of hidden politics. So for example, if you decide to add more documentation requirements on a state Medicaid form, that's not something that gets legislated, right? That happens within the executive branch. It doesn't get a lot of media attention. It's seen as the details of administration. The effects are generally probably not widely understood. And it can also be presented in a politically neutral way, right? It can be presented as preventing fraud, which most of us agree is a good value that we want to maximize.
Can you add one more there? The response to a scandal/crisis, because there are a lot of these types of things that get added administratively, which are direct response to something that just happened, that the information that happened.
Good point. Yes.
I'd also make this argument that when we talk about burdens, to the extent we talk about them, we're certainly talking about political values. So most of the framing arguments I've made have been arguments about access as a value, right? Whereas I could have also taken on an argument about fraud and public integrity and reducing waste. That's also a very legitimate public value we should care about. One of the papers that we wrote tried to figure out how we think about how these values play themselves out in the construction of administrative burdens over time. There's a couple of really simple demonstrations of this. One, we just looked at how onerous Medicaid forms were across the 50 states, how many questions, how much documentation was required if you were this hypothetical 37-year-old woman with 2 kids. So generating that some measure of complexity or burden there, at least on the compliance side, we found that we didn't explain much of the variation, but the only variable that really moved things was political control of the state. Right? If there was unified political control of one party, the forms tended to be longer. If there was unified political control of the other party, the forms tended to be shorter. You can guess which parties did which. The second paper was a qualitative paper where we just looked at a single policy over time. We sort of really dug into very minute changes in Medicaid access in Wisconsin over the course of about 15 years across 3 governorships. And we looked at how the ways in which the governors talked about that policy seemed to trickle down to very specific changes in things like how much help they would give people to get signed up. Right? So a governor who presented access to public health insurance as being about all kids did a lot to try and get nonprofits to round people up to get signed up for health insurance. Whereas our current governor, who's portrayed this more in terms of risks to waste, fraud, and abuse, has certainly pulled away help and increased demands for verification of people's status as they try to get access. So these political values do seem to matter in how bureaucrats impose burdens on citizens. There are cases where the hidden politics of burdens become visible, and the two examples we talk about in our book are in abortion and in voter ID. And they're visible here because they actually end up going back to the legislature and becoming part of traditional politics. People take a vote on them, you know where the two parties stand. So we have very clear evidence, just looking at the partisan voting patterns on voter IDs, where each party stands on this. An interesting piece from USC, so I thought I should mention this. Christian Gross and I think it was a PhD student, did an audit study where they looked at the sponsors of voter ID bills in the different states. They sent them hypothetical requests for information from a hypothetical Latino constituent and a hypothetical white constituent, and then just tried to measure the responsiveness they got back from the sponsors of these bills, and found that they tended to get more responsiveness when the hypothetical constituent had a white-sounding name, right? And so they suggested perhaps there was some either conscious or unconscious racial bias that was motivating the sponsors of these bills. One other observation that we make is that interest groups play a fairly important role in identifying burdens and bringing them to the political realm, right? So one thing that's true in both the abortion and voter ID example is that you have incredibly powerful, well-organized interest groups on both sides who know very well exactly how onerous a change in policy is going to be for citizens. And they're very sophisticated in making those arguments, and so they push those arguments back into the legislative domain. Another question is whether citizens actually identify burdens as a policy issue. So going back to the example of voter ID, in general, citizens by majority support voter identification laws. If you ask them, most of them do, they do tend to change their perspective somewhat if you frame the questions differently. So if you tell them it's about reducing fraud, support goes up. If you tell them that voter ID laws might reduce turnout of eligible voters, support goes down somewhat. But perhaps not surprisingly, this is also affected by their ideological beliefs. So people who are more Republican and watch Fox News tend to be more supportive of voter ID. Fox News has an effect independent of your political beliefs. We might also worry about, or at least be concerned about, how these perceptions of burdens vary across populations. When as citizens we have very different experiences of the state as being more or less burdensome, that probably then affects how we think about the state generally. A fascinating area that I think should be of interest to students who care about administrative law is the role of the courts here. And this is partly because the courts have thought about the idea of burden in a more explicit fashion than I think many legislators have. Again, in the areas of voter ID and abortion, courts have articulated this notion that the state cannot impose an undue burden that limits access to what are constitutional rights. But courts vary quite a bit in how they interpret what is undue or not, right? So in some cases, courts very much defer to legislative intent in writing statute about whether something is burdensome or not. And in some cases, they look at the empirical evidence. So this is a long quote from Judge Richard Posner of the Seventh Circuit in Chicago. So Posner and that circuit oversees anything that comes out of Wisconsin. Here he's talking about Wisconsin's voter ID law. And Posner is articulating here an argument for using empirical evidence to understand the effects of burdens. he's basically making a cost-benefit analysis argument, saying if you put some sort of burden in place, tell me what are the benefits that it brings, and tell me what are the costs that it imposes. And he's doing this to push back against the argument of the other side, ultimately the winning argument in this case, which is that all that really matters is that the legislature believes the benefits of the burdens outweigh the costs. And so Posner uses the hypothetical here of if Wisconsin legislators say that witches are a problem, shall Wisconsin courts be permitted to conduct witch trials? To what extent should courts and the administrative state more generally defer to stated legislative beliefs, which may or may not be sincere beliefs about the nature of burdens when they're making decisions about whether those burdens are undue or not? In that policy area of voter ID, by and large, we're putting up with what are probably undue burdens as a matter of Supreme Court law. In the policy area of abortion access, we're not, because of the Women's Health versus Hellerstedt decision last year, where Breyer takes very similar language to what Posner had proposed in relation both to voter ID but also to abortion, and basically says many of the rules that states are putting in place that limit access to abortion provide no demonstrable benefit. They do not provide the claimed medical benefits that are protecting the lives of mothers, but they do have some measurable or logical effect on access. And if you use that cost-benefit metric, they would fail. So here I think the courts actually provide a model for us to think about how we should measure burdens, right? Burdens exist. Sometimes they serve good purposes. Sometimes they provide very little return. And we should think about those costs and benefits when we're assessing them. There's another set of questions about how burdens affect citizens. And one is, are citizens actually getting the services to which they are entitled? And the flip side of that is, are states implementing policies that are actually achieving their goals? So if you think about any policy as being some sort of treatment, it becomes more successful the more of the desired population that you reach. If only 50% of the desired population are receiving the treatment, the policy is only going to be half as successful.
Excuse me, can you talk about where compliance fits in with this? Because I'll give you a specific example. Kids getting services for special needs. And the people that work in that industry will tell you the family will get what they are eligible for if the parents ask for it. Because they're at capacity, they don't volunteer the required benefits. And so where does compliance and enforcement fit into something like this?
So that's a very relevant question, given that federal government oversees much of the enforcement on special needs, and their stated stances on access probably influence the degree to which states are also going to see variation in compliance, right? So I think that your point suggests two different things. One is that the squeaky wheel gets resources, and that suggests that if you're a parent like me who has relatively high income, has high levels of education, has some free time, I will learn about what the law is, or I will hire a lawyer. I will have a social network that will give me information that will enable me to make strong arguments to the local school district that will ensure that my kid gets all of the things that were promised in their IEP, for example, right? And so there's a selection then of types of people who have high levels of, I'll talk about this in a second, a variety of human capital that will tend to be more successful in getting access to resources, while people who don't have those qualities will be less successful. at a broader level, we're all working within a policy framework where those threats become more or less viable only if there's a credible law enforcement mechanism behind it, right? And so if the state or the federal level has made clear that they're uninterested in implementing or devoting resources to ensure the compliance of certain laws, my ability to get access to those resources generally starts to decline.
Yep.
Yeah. Actually, there's an example I used, an article I used in my MBA class. Is some study in some Nordic countries, I forgot, which is about sort of involving some welfare recipients. They form kind of a chat group facilitated by the agency to help them to sort of share information about how to access services. That could be kind of another dimension.
Yeah, I wanted to ask if there's, related to the general research agenda, if there's a literature that focuses on third parties that potentially benefit and even perhaps lobby for administrative burdens to be imposed. I think like specifically of like veteran service organizations, right? That veterans who belong to the VSOs get quicker access to benefits. It can more easily navigate the VA bureaucracy than those that don't. And the VSOs use that as a recruiting tool for many of these veterans, right?
Yeah.
Towards their organization.
There is this is a fascinating question in this agenda. What is the role of third parties here? Because I've premised the opening question as being about citizen-state interactions, which says there's only two parties. But in the reality is we live in society, there are these third parties that play other types of roles, right? And so one of our questions is, what role do third parties play? And in some cases, third parties play service delivery roles where they can choose to, like bureaucrats, increase or reduce burdens. There's a really good example from job training when you look at private nonprofit actors who are providing job training services, and they have performance bonuses, the way in which they actually use burdens to try and maximize their profitability, right? So if they want to engage in creaming, get the people that they see as less tractable potential employees off their roles, they'll do things like sanction them and then just make it very administratively difficult to get back on access to services, right? So let me finish answering Bill's question, and then I'll jump back into yours. But there are also some cases where third parties can play a role in reducing burdens, right? And I mentioned the EITC does this by taking advantage of third parties like H&R Block, right? H&R Block was one of the strongest lobbyists for expanding the earned income tax credit over time. They built offices in neighborhoods where they felt like that they could get access to people who were receiving the earned income tax credit. They lobbied for electronic applications that would allow EITC reimbursements. So they've been a very powerful actor, not just in shaping the policy landscape to make that resource more accessible and less burdensome, but also in directly helping people to get access to that resource. And the H&R Block is doing that because it makes sense for them from a business perspective, not because they care inherently about the administrative burdens that people encounter in their interactions with the state. On the flip side, the makers of TurboTax have been the primary opponent to simplifying tax reporting by individual citizens. So the majority of us don't really need to fill out a tax return. The federal government and the state government already has our income information. It has most of our personal information. And in many countries, they don't fill out tax returns. You get something in the mail that says, here's what we think you owe. Just sign if you agree. And I think California does this on a very small pilot basis. But burden of completing tax returns for most people has been maintained in large part because the tax preparation industry has lobbied incredibly aggressively, mostly in California, but at the federal level as well, to stop the adoption of a simplified tax reporting system. So third parties can shape the policy landscape about how burdensome access is. They can increase or reduce burdens by their actual delivery of services, and they can also play a role in reducing burdens if they're helping people to manage the process. So, using your examples of veterans groups.
So I don't know who they're at first here.
Well, I was just on third party. There's another third party interaction where they actually become a beneficiary of the benefit themselves. So, I think about like the low-income housing tax credit. It's a very complicated program. There are specialists who then consult with the parties who are going to try to access the credits. And those consultation services become part of the basis that determines the size of your credit, so that you become a direct beneficiary. But the H&R Block is more indirect because people come into them, but the EITC funds, none of them go to H&R Block so explicitly. Whereas in the syndicator case, it's an easier case to be made that they're getting paid by the program that they're helping to facilitate.
Same with most contingent liabilities, flood insurance, guaranteed loans. There's a third party that's benefiting to deliver on behalf of the government, but also to basically help the recipient facilitate the administrative burden of accessing those.
So I will follow up with both of you afterwards to get more details on those examples. Maybe the more analogous example in the EITC is the restaurant industry. So when the earned income tax credit was created in its first iteration in the 1970s, it didn't have a lot of business support. The US Chamber of Commerce wasn't strongly for it, but over time, they became much more supportive of the EITC, and especially the restaurant industry has lobbied strongly to maintain and expand the earned income tax credit because it allows them to pay workers lower wages, right? It's one way of thinking about it is that it's a wage subsidy. And so if you look at any time there's a federal debate about, or even a state level debate about increasing minimum wage, there's also going to be a whole set of op-eds about expanding the EITC instead. And for a long time, there were these sort of astroturf lobbying groups where there was a think tank promoting these op-eds that was funded by the restaurant industry, but they were relatively successful in making the policy argument that the earned income tax credit was a much better policy overall, but it was really benefiting certain groups over others, right? If you're running a restaurant, getting a subsidy from taxpayers in general that allows you to pay people less is much preferable than paying them directly.
Sorry, it took a long time to get back to you.
I had a question which you mostly already answered, but I guess just a comment. I think the role of the private sector, I see it as bigger than it feels to me a little bit buried in the way you're presenting all of this. And just in terms of social policy provision in the US, the private sector plays such a tremendous role across so many social policies that we have, almost like co-producing with government in a lot of cases, but then cases like your question, Havana, that I don't see where the private sector is maybe not in that case, but it's in so many cases like this. It's hard to think of one where it's not, like including universities and financial aid. And the thing about the private sector is they're going to be benefiting so much of the time. They do need to have a profit with what they're doing, and so that's kind of always there. It's somehow the way you have it with thinking about the private sector being able to reduce the burden or lobby or increase the burden. It doesn't seem to capture that like the private sector is actually in so many social policy areas especially really wrapped up in the service provision.
Yeah,
Just
I
a
mean, this
broad
might be a
comment.
function of,
Seems to be sort of missing in all of this is that big role of the private sector.
It might be a function of the way we're structuring the book is chapters about specific policy areas like the earned income tax credit or Medicaid or Medicare. And so we're taking sort of a policy first view of the world there that might understate the role of the private sector as co-producers. If you have different language, that could help to reframe that contribution. I'd be happy to talk more about it. So I think we've touched a little bit on this point, but the way in which administrative burdens can matter to inequality. And I think they matter in two ways. One is that some people are more likely to be targeted by burdens than others. So I remember talking about this topic a couple of years ago in a very nice resort in Lake Como in Italy, and Richard Walker was there, and he lives in Hong Kong. And he said, well, this doesn't really resonate for me. This is not my life. And I said to Richard, yeah, you go through the airport, you have this fast pass, you skip the lines, you can buy your way out of many of the burdens that you encounter, but you're also not encountering the state as a supplicant in many cases. And so you're not in a position where you're trying to collect the earned income tax credit, where you need additional documentation to vote, where your life is relatively simple. So Richard or I are generally not targeted by policies where we have to encounter a lot of burdens. But the second way in which inequality matters is that, let's say within a collective group, everyone in this room has to encounter the same set of burdens. There's going to be some distribution of human capital. So broadly understood, cognitive skills, educational skills, income, access to social networks, those matter to whether you get access to things. This is a really simple example, again, going back to my example of voting. Here we're looking at a cohort of older voters in Wisconsin from the Wisconsin Longitudinal Study. This is a paper that just came out in the Journal of Politics, if anyone is interested. And we're comparing how different dimensions of health, which is an aspect of human capital, matters to whether you get out and vote or not. And one is cognition. So it's really more a measure of whether your cognitive skills have declined over time, because it's a panel study. And the top one is the Health Utilities Index, which is mostly a measure of just general health. We also include walking speed, like how quickly can you walk for a limited period of time. And these basic measures of health matter a lot to voting. We're using education here as a comparison point. They seem to matter more, especially the general health indicator, than education does, to whether you get out of the house and go down and vote somewhere. And that's a very specific cohort that lives in a state that generally has relatively low burdens of voting processes, but where variance in human capital on this one dimension of health does matter to whether you participate as a citizen. It's also the case, and some economists have made this argument quite well and demonstrated it, that the situation or stresses of poverty might exacerbate the cognitive biases that make you more likely to make bad decisions, while at the same time we have some evidence that measures of class and race matter to whether you're able to overcome programs. So I won't go through all of these, but this one paper by Elizabeth Rigby, going again to the voting example, looked at as states introduced election day registration over time, so instead of having to register 28 days ahead of time, you could register on election day, which voters were brought into the participatory process, which voters became more likely to vote, tended to be younger and minority voters and low-income voters. So people who moved a lot, right? Because they were the ones who were most affected by registration requirements. If you've lived in the same house for 30 years, registration requirements don't matter, but if you're someone who is going to encounter that burden a lot, you're going to be advantaged more by reducing that burden. So as a public administration scholar, I have to come back and think about what this means for administrators. Our qualitative studies in Wisconsin made, I think, a good case that administrators play a role here that is important because they have specialized knowledge about policy. They have this in-depth knowledge that allows them to think about how do you design policy that could make experiences more or less burdensome. So an example from Wisconsin is when the governor said, we want to get more people signed up so it's more like almost a universal healthcare program. How do we do that? You have bureaucrats who said, well, the way in which you reach the hard-to-reach people is you work with nonprofits that live in those communities and you give them the power to sign those folks up. That's the way in which you get greater access. But they knew that because they had that sort of policy expertise. Did you have a question?
I do. So sorry for interrupting because it was back on the last slide. It seems to me, if we're thinking about from the perspective of a citizen, that what you've presented to us is that there's these set of things on the supply side for a citizen for engaging with the state. Some of those are more or less burdensome, have more or less costs associated with them, and some of those purposefully, or maybe all of them, have a strategic aspect to the way in which those are designed, supply side wise. But there's also, so this stuff, with respect to the health of voters or other things like that, there's also, and cognitive capacity and resources, those are on the demand side of the citizen. And so in terms of whether or not, they have to go, they work 3 jobs, so they don't have the time to go out and vote or whatever, or look into Medicaid forms or tax forms or even figure out where H&R Block may be. Like, these are demand side aspects of a citizen and how they engage with respect to that. Some of those are, we could lower the cost administratively for them with respect to helping to up demand. But other things are much more difficult, I would think, from a perspective of a policy choice or arrangement of things. So is that the right way to start thinking?
That's a very elegant way of presenting it. I had not thought about that. And I think that dichotomy is really helpful. There's some areas, especially I think on the psychological burdens, where the dichotomy breaks down a little bit because what the demand side of my psychological experience is driven by factors probably related to human capital that the state can only partially mediate there. But I think in general, that's a really nice way of thinking about, if you're looking at the policy areas, what are the demand side and supply side factors that we can actually gain some leverage on.
But it sounded to me that a lot of what you've been described in terms of social policy is about first-time applicants. So if I've been getting food stamp for the past 10 years, I wouldn't stop filing something just because the process gets more complicated. So do you know how the changing the levels of burden affects the existing beneficiaries?
It still matters for existing beneficiaries because in most social programs, you have to recertify your status over time. So in some, I think in food stamps, one of the big changes that they made was moving from, I think this was under the Bush administration, a situation where states had to recertify individual status every 6 months to allowing them to do it every year. Right? But that's still relatively frequent, right? So you still have to go through the paperwork, you still have to talk about whether your status has changed or not, and you still at least have to engage in some learning costs to know whether the demands have changed. Right? If you have to, if the requirements are now slightly differently, if you're still eligible if there are other people living in the house with you. So that it's not completely inconsequential. Once you get on the program, you still have to engage in some of these burdens over time. The exceptions to this would be like something like Social Security. Once you're on it, you're on it. You never have to worry again about it. Okay, the other ways in which I think administrators have a role to play here is in using their administrative discretion, right? And so here, this is an area that I think street-level bureaucracy literature covers very well. This is a set of examples from voting once more, where if you're trying to vote in Louisiana in 1964, you have to answer a series of ambiguous questions. So what's the answer to the question of spell backwards, forwards? Or right from the left to the right as you see it spelled here. The point is that there are a variety of potential answers, but that the administrator has discretion in deciding which one is the right one, depending on who you are. And so here, burden is something that they can impose selectively upon claimants. More contemporary example, an audit study that was published in APSR, where, again, these hypothetical constituents, some Latino names, some white-sounding names, sent emails to local election officials and found that, on average, asking a very simple question, what do I need to vote? An average found lower responsiveness and lower quality responsiveness when they had Latino aliases.
Is there, within this kind of general framework of administrative burden, could it simply be sometimes a case of activating administrative discretion when you know that the administrators have proclivities that are against the recipients? And I'm thinking specifically of Customs and Border Protection right now, where you don't have to impose anything on the citizen other than what already exists. You're just allowing the administrator, that street-level bureaucrat, so to speak, to more readily use their discretion.
Yeah, that's a fascinating example. I mean, so the hypothetical here is that maybe even if there's no formal policy change, administrators feel more emboldened to act upon their prior beliefs, or even if they're not their prior beliefs, they feel like the leader of their government is telling them something that they should be doing, maybe not formally, but that they should use their discretion more aggressively to engage in extreme vetting.
That's right.
And so it could be both that they have strong priors, they don't have strong priors, but they feel like they need to be responsive to the president, but they have some area of discretion that they can exercise selectively among the people who are coming into the country. Yeah, no, that's something I've been thinking about too. Let me skip ahead a little bit. I think you've seen all of these slides, so I'm going to try to conclude here quickly. So normatively, I've sort of made the argument that in many cases, burdens are higher than we might anticipate, that we should look for ways to reduce them. There are certainly going to be cases where that is not true, but one really good example of a program that was designed in the United States that has very minimal burdens is Social Security. And we think of Social Security as simple. If you read James Q. Wilson's Bureaucracy, he says, he classifies it as a production agency, says SSA was given a relatively simple task that was carefully defined by law. And that assumption really understates how complex this program was and how difficult it was to create amid fierce political disagreement. At the time, it was called the biggest bookkeeping organization in the world. The federal government had to find a way in the course of about 10 months to enroll 26 million people in a new program. And they thought very carefully about the design of this program to make choices that minimized how burdensome it would be. So one choice that they didn't make was to have people use stamp books. This was one of the policy suggestions. Your employer would give you a stamp book. You'd sort of fill it out with stamps every quarter. You'd keep that throughout the course of your life. And then at the end of your life, you would turn that in. Right? Burdensome. You could easily make mistakes. Opens potential for fraud, for a market for stamps. We think about Social Security numbers as simple, but they didn't have them before that, right? And it wasn't this uncontroversial idea at the time. This is Governor Landon, who was running against Roosevelt in 1936. The administration is preparing a plan, the exact nature of which we shall not know until after the election, for keeping the life records of 26 million of our work people. Imagine the vast army of clerks that will be necessary to keep these records, check up on the people whose records are not clear, and so bureaucracy will grow and grow, and federal snooping would flourish. We think perhaps of this as being a very different time, very different politics, but the concerns about the size of government, government intrusiveness that we hear about today were very much there at that point. But they implemented Social Security numbers. They adopted a very effective public relations program. The first version of SSA had this information office that created posters like this that explained, using a very positive frame, what the program was, how it would benefit you, because at the time they were also competing against contrary messaging, so that this document came from the Republican National Committee in conjunction with business owners, put it in the pay envelopes of many employees, saying, may not be able to read this, this is a pay deduction. You might get this money back in future years, but only if Congress decides to make an appropriation for that purpose. And so at the time that this is affecting the learning that people are engaging in about the program, as well as their general beliefs about the program. Right? The creation of field offices across the United States helped to reduce burdens, allowed people to gain help. And there was a very deliberate choice in the training of people who worked in field officers that they were to treat people with respect, that they were to treat them as if they were getting a right rather than getting welfare. There's lots of quotes from people like Roosevelt and the people who worked for him that this was social insurance. This was not a form of welfare. You had earned this right. Yes?
But in terms of the politics of the way in which this was designed from the start, they purposefully excluded, it was based on race, and so they excluded farm workers and domestic workers so that they could have a respectful organizational culture of service, because there were fewer African Americans who were eligible for Social Security at that time than before. So it's, yes, but it's also because they, at that sort of, if we go back to that supply side, they took out part of the racialized aspect of benefits that can be gained from the state.
Yeah, that's completely true. And so the sunny narrative that I'm painting about SSN is dependent on sort of a race-based structure of populations. That being said, the gradual expansion of the program over time depended upon this initial success. And so by 1939, you start to see the program expand to go beyond the initial groups who were covered, only because between 1936 and 1939, they had been relatively successful in presenting this as some sort of positive insurance that all could share in. You still see that debate going into the creation of the Earned Income Tax Credit as far as the 1970s, where you have senators from the South in particular arguing that some sort of negative income or basic income would drive away their maids and the people that worked for them. There's very explicit language about that for decades to come. So yes, you can't sort of write that part of the story away. But part of the point about Social Security and some of the other choices about burdens is that there are probably times where you can reduce burdens without engaging in value trade-offs, right? So in particular, if there's a consistent trade-off between access and integrity, there are probably design features that can maximize both. In another paper, we talk about the use of auto-enrollment. So when the state has information about applicants to programs where it already knows that they're eligible for the program, they auto-enroll them in the program. Or a variation of that is if people who are below a certain income threshold are automatically re-enrolled in the program rather than have to recertify their status every 6 months or every 12 months. And partly that's better at improving access for obvious reasons. You don't have to do the paperwork, but it also improves integrity because you're not relying on people's own estimates of their income, which tend to be less reliable than state-collected estimates based on employers. And so part of what we're hoping to produce with the book is not a message that burdens are always problematic, but that there are more of them than we probably acknowledge, that they're politically constructed. But part of the job of public administration and public policy is to think about how to design burdens in a way that improve multiple values at the same time, that improve the policy goals you're trying to achieve, improve access, as well as minimize fraud in these programs. I'm ready for even more questions. Fire away. Kathleen?
So I think this is a really interesting topic, but I'm curious in your sort of studies of the 3 different policy areas where you're really diving in, how the decisions about the burdens are being made. It seems like many of the burdens are not unknown, to elected officials, and in some cases may be really purposefully put there to suppress enrollment or to save certain kind of money. Have you sort of, through your work on the book, found any kind of takeaways you can, or a way of understanding exactly how politicians and elected officials are making these decisions about burdens? Because you can say that there are cases where we can tell administrators to use their discretion in a way that minimizes burdens, but a lot of the decisions about the burdens are being made at a different level, being made purposefully. And I'm just thinking about an example, even in a liberal administration, in the Obama administration, when they moved to income-based repayment for student loans, which is a program most people don't know exists. Signing up is really quite onerous, and there were a lot of arguments that they could use IRS records to get people signed up, they almost automatically. And even in administration, it seemed to be very, they chose to create income-based repayment. They supposedly have this set of values, but why are they instead creating a system that is actually quite hard for people to enroll in? And if you're finding when you're looking at, it sounds like you've done a lot of work at looking at what governors are doing, are there some kinds of arguments that you make in the book about how elected officials go about making these decisions?
Yeah, so I think on one side of the ledger is the fact that governors or presidents or legislative values matter. On the other side is the degree to which burdens are opaque and their effects are opaque, right? And so another Obama administration example would be the rollout of the Affordable Care Act and the federal exchange, which was a disaster, which was, 6 people managed to get health insurance in the first 24 hours. That's an example of where burdens were unintended because of, not because of political values. You have a political principle whose value is to maximize enrollment, and you just have a bad administrative rollout, right? So that category of examples exists, and I think if you look at the red tape literature, that the sort of assumption is that that's the dominant example, burdens occur by accident, despite our best intentions, or because some crazy rule was on the book from 120 years ago and we've never taken it away. So that's one category. There's another category where burdens are just politics, in a sort of classic sense. We basically understand where elected officials stand on voter ID and abortion, and they might articulate policy arguments that are distinct from their actual sincere beliefs, but we mostly understand where they stand. And they vote according to those stances, and they have a reasonable understanding of the consequences. That's the second category. I think the interesting third category, in the place where the book makes the most contribution, is where elected officials have policy beliefs and they're using those values to increase burdens in a way that's intentional but is opaque to the general public, right? And that's where, you know, the governor pushes to add more documentation requirements on the Medicaid form, which is not something that's generally part of public politics, doesn't get a lot of attention. Maybe you have some interest groups that pay attention to this, but it's not a popular topic for the media. You might have some oversight committees that sort of understand what's going on, who might choose to weigh in. But I think you could think about almost all of the relationships between politics and burdens as falling into one of those three boxes. But for me, political science does a really good job of when burdens are explicit politics. So most of the examples on abortion and voter ID I've pointed to come from political science. I think the place where public administration scholars can contribute to the most is in that murky area where there are political beliefs, but the effects of burdens are really sort of opaque.
I want to take another run at this private sector thing.
Okay.
I really like the murky area that you're talking about, and it seems like there's so little work in that area on these topics you're talking about. Just like from a normative perspective, it seems like the really problematic place for there to be a lot of red tape are the burdens in this murkier area. So I'm not talking about voter ID and I'm not talking about abortion now. But burdens that are not absorbed by the private sector and being involved. So for example, maybe making financial aid forms way more complicated is not as much of a problem if universities are absorbing a lot of that, because universities get that money and trying to help students with their financial aid forms, I think. I don't know. I shouldn't say so much about things I don't know about. But examples where there's not a third party that would often be in the private sector that is playing a role in absorbing those burdens, we may not have as much of a problem with that. In some ways, they're not being borne by disadvantaged citizens themselves, but those burdens that are being borne directly by individual and especially disadvantaged citizens would be the ones that would be the most concerning to me, and to me the ones that would be the most to gain, like from public administration, figuring out how to reduce those ones, but not necessarily, at least in my view, the burdens that wind up being absorbed by the H&R blocks or the universities or other examples that we might think of kind of private sector stepping in for their own reasons and incentives and taking care of them. But it's this other group where that's just not there that seems the most interesting and exciting area to explore to me.
Build on your point for 1 second. So I think you're raising something really interesting about when they absorb it, but I think even in areas where they do absorb it, so if you think about something like 401ks, whether or not that is being absorbed by the private sector will, again, still depend on who you are. If you're working in some kind of you're working a clerk in a grocery store, I don't think they're probably necessarily helping you set up, even if they don't contribute, they're not necessarily helping you. So I think it's even more murky than what you're talking about, because the areas where the private sector does absorb it will also depend on what area in the private sector you're employed in or what area.
I wanted to, I guess, jump in there a little bit too and be a little bit pessimistic about the role of the private sector, because I think to the extent that they absorb the burden, they also often try and capture the benefit. And so for-profit higher education has, did some very aggressive recruiting, which I can easily imagine those recruiters literally sitting down with someone and taking them through the FAFSA, but they spend a lot more time on that part of absorbing the burden and not as much on finding an actual match between the student and the course of study.
Yeah. Did you want to follow up on that?
Yeah, it's actually quite related. It was many years ago, I used an article that talks about developing countries. So in many developing countries, there are a lot of burdens on, say for example, if you run a business, you might have to get 1,000 stamps in order to operate legally. It's true in China, in Latin America. And in that particular article, I think it's about Brazil or Argentina. So they interview the enterprise. So how do you cope with having to get 1,000 stamps in order to run a business? And they said, oh, actually it's not as burdensome as you thought, because usually we hire a company that will take care of the whole thing for you. So then it's kind of an example of sometimes the private sector is a business in terms of helping the people to meet those administrative burdens. So I don't know whether maybe in the US it's less prevalent, but in developing countries it's a very common example.
I think there's a specific term in Brazil for that person. And in Portuguese, they have a particular name whose job it is to speed up bureaucracy.
So it could be corruption or whatever.
It's similar to what you were saying about being a high-income parent and being able to know and have networks. Very similar things, like contracting out is very simple in that.
Yeah, so this is very helpful to me. I mean, one thing I'm taking away from this discussion is the part of the book where we talk about third parties has to map out those various roles a little bit more explicitly, but also that there are conditions where we would expect third parties to be present. One is where they have some sort of profit opportunity to help reduce the burden. But the second is among populations with high social capital, right? Or maybe not social capital is the right term, but the combination of social capital and access to resources. So if, my population of mostly white, upper to middle class professors that live in my neighborhood has to deal with some burden that the state suddenly imposes upon us, we have a mixture of social capital, human capital, and other types of resources we can bring to bear. Even if there isn't a private third party that comes in to help us, we can form our own social groups to push back. Where you don't have the mixture of those things in policy domains, where you don't have the combination of those things, I think part of what I hear you saying is that that's when either third parties could play the most benefit, or the state should be thinking most carefully about how it designs burdens that it imposes upon populations.